Hello everyone, welcome to Learn Medicine Easily YouTube channel. Subscribe our channel for more videos and also push the bell button to receive our video notification first. So in today's video I will explain the COVID-19 X-ray, chest X-ray review. So chest X-ray review. First of all, before of that, I go to explain the chest X-ray of a COVID-19 patient. I want to explain the normal shape of chest X-ray. So the first thing is you should take a normal chest X-ray in the posterior anterior position. So this is very important thing. So you should take a normal chest X-ray in the posterior anterior position. And what you should look for in the normal chest X-ray, so you should look for the location of trachea, which is located slightly to the right side, but near, it is actually near to the midline, so you should see for the location of the trachea. In some diseases, this trachea will push to the opposite side of the effect. So when we are taking the chest X-ray of the patient and we find the trachea to the opposite side of the affected area, so we should have some less option to diagnose the disease. And also in some condition it will come or drop to the side of affected area. Suppose this area is affected, if it drop trachea to this side, so we will have less option to diagnose the disease. In some diseases like consolidation, in disease which are combined with consolidation, bronchiectasis, other disease, if this is affected area and it push the trachea to the outside opposite side, so it is other disease like pleural effusion or other things. So we should look for the location of the trachea, and also we should look for the ribs. So these are the posterior ribs. You can see the first ribs up to 11 ribs, and also these are the anterior ribs. You can see only 4 to 5 anterior ribs in the posterior anterior chest X-ray. So you should look for these things. Also you can see a trachea in this X-ray normal condition, and also these are the ventricles, and also you should look for the cardiothoracic ratio. It means if there is cardiomegaly, you can find it. But now in the COVID-19 patient, the affected area or the focus area is the lungs, so we should know about lungs. In the lungs, so these are anterior ribs. In the lungs, you should look the apex of the lung, if tension if pneumothorax is present or not, and also you should look for costophrenic angle, the angle between the diaphragm and the ribs in the both side. If it is not present, it means there are some fluid in the pleural cavity or pleural effusion is occur. So you should look for these things in this X-ray, in this colored X-ray. It is easy to see these things. So the clavicle, the ribs, you can see all the ribs, and also you can see the heart, the ventricle, and also you can see the big vessels in this X-ray. Then come to the next slide, what to look in a COVID-19 patient chest X-ray. So first of all, you should look for pneumothorax, if pneumothorax is presented or not, and also you should look for subcutaneous emphysema. And other things in the periphery, you should look for lesion of ribs or pleura, lesion of pleura or ribs. And also you should look for this angle, as I told, for the effusion. And also you should look for the diaphragm, it is under pressure of ear or not. And also you should look ear under the diaphragm, is there any ear in the under of diaphragm or not. And also you should look for pneumomediastinum. These things you should look for in a COVID-19 patient. So common and very big problems or diagnostic things in the COVID-19 patient is numbered or collected as four very big things. So the first one is ground glass. The first one is ground glass density. So you can say this ground glass density, I have pointed it with the white arrow. You can see this ground glass densities look like ground glass. You can see in a COVID-19 patient chest X-ray. And the other thing is bilateral lower lobular consolidation. So you can see this bilateral lower lobe consolidation in the chest X-ray of a COVID-19 patient, and how we can differentiate it from the bacterial pneumonia. So the bacterial pneumonia is only in the one side or one lobe. So in the COVID-19 it is in the both two lungs. So you can easily differentiate it from bacterial pneumonia. You can see the lower lobe, this consolidation, lower lobe, bilateral lower lobe consolidation in all of these pictures. So there is the consolidation, bilateral lower lobe consolidation. And the third thing is peripheral ear space opacity. So you can easily see this opacity in the peripheral of the lungs, peripheral ear space opacity. So these are also in the COVID-19 patients. So peripheral ear space opacity, you can see these things, peripheral ear space opacity. This is the third and very big things in the COVID-19 patient chest X-ray. And also you can see some ear cavitation in the X-ray of COVID-19 patients. So this is the last things that you can see, these cavities, these abnormal cavities or ear cavitation formed in the lungs. You can found these cavitation also in the chest X-ray of the patient. So you can found these things also. You can find these abnormalities. So as a conclusion, you can say that we can see in a patient chest X-ray of COVID-19 patient ground glass density like this, and also bilateral lower lobular consolidation, bilateral mean in both side, bilateral lower lobe consolidation, and this is the big differentiation from the bacterial pneumonia, which in the bacterial pneumonia we have consolidation only in one lobe or in one side. In the third thing is peripheral ear space opacity. You can see the peripheral ear space opacity here. So this is the third thing in COVID-19 patient chest X-ray, peripheral ear space opacity. And also the last thing is the cavitation, ear cavitation in the ear cavitation or in the ear or simply cavitation in the chest X-ray of the patient. Thanks for watching. For more reviews, subscribe our channel and don't forget to push the bell button to receive the notification of our new videos first, and also share our channel with your friends. Thank you.